Radiation therapy is one of the most common treatments for cancer. In this video, we will give you an introduction to the steps of your radiation treatment procedure. Patient arrives to hospital to talk with the oncologist about the coming treatment. The conversation takes place with the supervising radiotherapy doctor. To this meeting, you can of course bring a friend or a relative. The physician explains all the steps of the process, and you have the opportunity to ask detailed questions at this time. During this meeting, your physician will explain to you in detail the purpose of the treatment, possible side effects, treatment options, and any ancillary treatments. You will also be informed about how the treatment will be performed, for example, how many exposures are likely to be needed. In most cases, you will receive irradiation 5 times per week. At the end of the conversation, you will get an appointment for treatment planning, typically occurring within 3 to 5 days. When planning, we use a planning CT, computerized tomograph. During the examination, we will test individual positioning, which will then be used during treatment so that you are always treated in the same position. It is important during the radiation that you remain still on the treatment table. A therapist will be present to assist you in the process. During the examination, an irradiation point is set. To be able to find this point during the treatments, small marks are made on the skin or on the fixation mask. In the planning CT, our staff will contour all organs which are in the radiation area. Then the physician defines the target to be irradiated. Next, the physicist calculates the radiation plan. In the target volume, the dose is optimized, and in the healthy organs, tissue, the radiation dose is minimized, so the possible side effects are reduced to a minimum. Your physician and the physicist discuss the plan to ensure that you receive the best possible treatment plan. The planning process usually takes 2 to 3 days. Prior to the first irradiation, the physicist has already verified that the correct dose is delivered using a special measurement device called a phantom. At the first irradiation appointment, you will be positioned on the radiation table in the same position as you were during the planning and the CT. The irradiation position is carefully checked with X-rays or a CT, and after careful review, the first irradiation is performed. The first treatment takes slightly longer, 20 to 30 minutes, as a result of the plan reviews prior to treatment. Often the actual irradiation only takes 2 to 5 minutes. During the following treatment sessions, the radiation during treatment and the position of your tumor are monitored and compared with your treatment plan daily. This allows revisions to be performed if the tumor changes its position or size, or if changes to your weight occur. You will then receive a new, revised treatment plan for the coming radiations. After the last treatment session, you will have a treatment review with your physician. You can of course bring a friend or relative to this meeting. The physician explains your course of therapy and what to expect going forward. This is your opportunity to ask any questions you may have about your treatment. Prior to leaving, a follow-up appointment will be scheduled. Likewise, any connecting treatments or a cure are determined or initiated so that you, as far as is possible, can go back to work again and can participate in social life, to move, enjoy sports and life.